welcome everybody to the Expert Roundtable, 20 years of treatment and care of Pompe patients. What we want to try to accomplish with this session is to take a moment and really have an interactive conversation with all of you, the other experts in the room, the ones sitting at the table today, about a wide range of topics. We solicited questions in advance, and so I've got some prepared, but we absolutely want audience participation. The more the better. To start us off, everybody up here is going to take a few minutes to introduce themselves and the institutes that they represent. And then from there, we'll go right into the question and answer session. So let's see, who did we have first? Dr. LaForêt.
Do you want to present your slides?
Yep. But you don't want to be first?
I can also do it first. Yeah?
So we have to tell you that two of us were a bit more lazy and the others were a bit more engaged on this, so they will show slides.
And we will talk.
But I can't agree at presently who is starting.
Yes.
So.
It would be more logical than Hans present first
Yep.
to all the work
Okay.
you did. And
So we start with Ans, the
Yeah.
perspective on the world from the Netherlands.
Yeah. So I just do it somewhere.
Yeah.
Somewhere. Because now I was asked to prepare, I thought, 10 minutes about what I'm doing, where we're from, and what my perspective is. And I thought maybe it's nice to know, because we are from, I'm from Rotterdam, Erasmus University in the Netherlands. And I thought maybe you're wondering, where is that in the universe? And you can see it's located on the other side of the ocean with the red dot. And to make it clear, I also put a red dot in San Antonio, so that's the distance. And it's only an ocean between, but with a plane, you're easily there. So in fact, we already working for quite a while on Pompe's disease, but in fact, our center was founded in 2008, and the reason was that was done by the board of directors because enzyme replacement therapy became available, and we became the center in the Netherlands for all the patients with Pompe's disease, and there it commenced. And in fact, what we did there, is that we started our organization, and in fact, we founded a structural collaboration between the departments of internal medicine, neurology, pediatrics, and clinical genetics. And I'm the chair of the center, and I'm helped here with Pim Pijnappel, who is the successor of Arnold since 2012, and Pieter van Doorn, who is professor in neuromuscular disorders, and Maina Dien and Hanrike play also an important role there. So in fact, this is our whole team, and it's a team of doctors, but also of paramedics. For example, we have physical therapists, we have neuropsychologists, we have dietitians, and the doctors from the different departments, and we have a lab with about 14 people who are doing preclinical and translational research on Pompe's disease. And what is our mission? In fact, to work together and to provide a home for patients with lysosomal and metabolic diseases and fulfill the unmet medical needs. So our main focus is, we have different focuses, but the main focus is Pompe's disease, and we have an important focus on lysosomal storage disorders in general, but also on neuromuscular disorders. Now, I already showed that we see quite a lot of patients, and that's because we see all the patients from the Netherlands. And this graph more or less shows that the number of patients we had over the years increased tremendously, and that was because all the patients came to our center since enzyme replacement therapy became available, and also the patients that are not treated are seen in our center on a regular basis. And there we have a big advantage because the Netherlands is a small country. It's only 200 kilometers wide and 300 kilometers on the other side. So it's easy for patients compared to the US to come to our center. What we also do in our center is provide home infusions, and that made it for the patients more easier to comply with their better infusions. And in fact, since 2007, we now did more than 27,000 infusions. I think we're now up to about 30,000 infusions. And at present, about 80% of these infusions are given in the home-based situation. And also children get their infusions at school, so that's really convenient. We regulate the infusions. In fact, the infusion preparations are made at Erasmus and then distributed to the country, and then a home nurse provides the infusion, and we train the home nurses. So we also give the education, and if there is a problem during the infusion, the home nurse can call us, and we give directions to do what to do. And of course, when there is an emergency, they have to go to a local hospital, and otherwise we can give advices through the phones. And when there are infusion-associated reactions, we always discuss with the patients that the next infusion is given in our hospital. Now, we have a long experience with Pompe's disease, and these are all the theses that have been produced over the years, starting with the first thesis of Arnold, that's on the left, and my thesis is next on there, and Henrike's thesis is over there. And we do a lot of research on all kinds of studies, on preclinical studies, and on studies in children, in adults, and more recently also in research on next generation therapies like AONs, antisense oligonucleotides, and on lentiviral gene therapy, and also on regenerative medicine. And some of these stories you will hear tomorrow by Pim Pineapple. So I realized, and that's always when I'm asked by Tiffany to give a presentation, that indeed I'm 35 years in Pompe's disease now, and that I started to work with Arnold in 1986 it is. And Arnold, you looked very similar at that moment. So, and I also did not change, you can see. So, now important things, of course, were the development of enzyme replacement therapy and the very first application of the enzyme replacement therapy with a product that we produced in rabbits and infants. And also a very important thing was the lot study that we did with other centers from the US and with France. I talked about it today, and that was also an important milestone. So what are our current activities? Our current activities are that we focus on the long-term outcome of ERT, that we focus on personalized medicine, on patient-reported outcome, and on implementation of next-generation therapies, and on the development of AONs and lentiviral gene therapy. And of course, what we find very important is collaboration, because in rare diseases, there are few patients, so we need to collaborate across the world, and therefore it's also very important to be here today. And thank you very much, Tiffany, for organizing this. We're very happy to be here, so thank you very much.